coming up next.
You're watching Channel 2 News. Coverage you can count on with Wendy DeMonte, Kristen Remington, Bill Brown, and Mike Alger's Pinpoint 2 forecast. This is Channel 2 News at 5.
It is one of the simplest symptoms of heart disease to manage. I'm talking about hypertension. Dr. Michael Bloch is an internist. He can answer all your questions about high blood pressure. To speak with him, call 858-2222. Lines are open until 6.
Thank you.
Coming up on Channel 2 News.
Dr. Michael Bloch.
High blood pressure is the focus of tonight's Ask the Doctor segment. Stay with us. We're talking about it coming up next. Nearly a third of all U.S. adults have high blood pressure, and they're not managing it properly. So we're talking about it in tonight's Ask the Doctor segment with Dr. Michael Bloch. You're the co-director of the Risk Reduction Center at St. Mary's. So let's talk hypertension. Is it something that you really need to pay attention to if you've got it?
Absolutely. Hypertension is really just a fancy word for high blood pressure. And it's a major risk factor for heart attack, for stroke, and for heart failure. So if you have high blood pressure and you don't get it under control, you're at increased risk for all those things that can wreck your quality of life, especially in your older years.
How do you know if you have it?
That's a great question. And it's one of the most difficult things about treating high blood pressure is it doesn't have any symptoms. So for most people, they have no idea if their blood pressure is high or not. Unless you go get it measured by a healthcare professional, either a doctor's office or a health fair, you have no idea if it's high.
So then you lower that, your high blood pressure, what does that do to your overall risk of heart disease and stroke?
Yeah, that's the thing that's a great opportunity about finding out that you have high blood pressure. If you find out about it, it does increase your risk, but lowering your blood pressure, usually through a combination of medicines and lifestyle changes, can reduce that risk dramatically. So just because you have high blood pressure doesn't mean you have to have a stroke. You can really reduce that risk dramatically by getting appropriate treatment.
Easy to manage?
Relatively. Everybody's blood pressure is different. Some people just have mild elevations. Some others can even be treated with lifestyle changes alone. Some people are going to have more severe elevations in blood pressure and need to take multiple medicines in addition to those lifestyle changes.
We're going to talk about those lifestyle changes coming up at 5:30.
Sounds good.
Dr. Bloch, we certainly appreciate it. Lines are open until 6. Pick up the phone right now. Dial 858-2222 if you have a question.
This is Channel 2 News. Coverage you can count on.
KTVN.com.
Coming up on Channel 2 News.
To speak with an internist about high blood pressure, pick up the phone and call 858-2222. Dr. Michael Bloch is taking your calls for another 20 minutes.
There's no explosion.
Are there natural things you can do to control your blood pressure? We're talking about it coming up next in tonight's Ask the Doctor segment.
Advantage of this offer.
It's called the silent killer. We are talking about hypertension, probably better known as high blood pressure. Dr. Michael Bloch is the co-director of the St. Mary's Risk Reduction Center. Thanks so much for being with us.
It's my pleasure.
Let's talk about natural things that people can do once you have high blood pressure. Is there a natural way to reduce it?
Certainly. Most people focus on medicines, but usually the treatment for high blood pressure is a combination of medicines and lifestyle changes. So the lifestyle changes that have been shown to lower blood pressure are improving your diet. Lots of fruits and vegetables, high fiber, low fat. Exercise, even without weight loss, can help lower blood pressure. And then weight loss certainly can. Other things that can also help are avoiding medications like anti-inflammatories that can raise blood pressure, avoiding decongestants. Some people have sleep apnea, and treating that can help blood pressure. So there are a lot of things that either instead of, or in more cases in addition to medicines, that can help lower that blood pressure.
Interesting stuff. Is there a way to prevent getting it in the first place, or is it a hereditary thing that you're just going to get one day?
Well, it's pretty common. There's about 70 million people who have high blood pressure in this country. It's about 1 in 4 adults. But certainly the things that I mentioned in terms of lifestyle changes, eating right, exercising, keeping your weight reasonable, can help prevent high blood pressure in many people. But if you have a family history, it's still important to get that blood pressure checked.
And don't ignore it.
Please don't ignore it.
Do people honestly just go off their medicines? Do they just get tired and...
Too often. It's one of the most common reasons for why people show up in the emergency room and other places with poorly controlled blood pressure is not taking their medicines. So yeah, if your doctors prescribe those medicines, they only work if they're taken every day. So they lower the blood pressure while you're taking them. If you stop taking them, blood pressure will tend to go back up again.
Do you have to take them at the exact same time every day?
Different medicines are on a different schedule, but in general, yes, same time every day.
Okay, Dr. Bloch, again, we appreciate your time.
It's my pleasure.
Thank you. And we have his contact information on our website. So for that and future questions, just go to ktvn.com. Kristen?